Hi, my name's Daniel O'Hara and I'm a kidney specialist from Sydney, Australia. Today I'd like to invite you to look at kidney disease a little differently. We often see it from a very negative perspective, and look, certainly there is a great deal of cause for concern. It's an overwhelming global problem affecting more than 700 million people. Most don't even know that they have it. And if the kidneys fail, only about 1 in 10 people have access to life-saving treatment like dialysis. It's a confronting picture. But I want to offer a different view. Kidney disease is one of the few major health problems where the early warning signs are often there decades in advance, creating the opportunity for early action to completely rewrite the ending. For most people with kidney disease, the kidneys worsen slowly over time. Making the right changes at the right time can make a dramatic difference to the future. Let me show you what I mean through the stories of 2 people I've cared for, stories I've seen repeated over and over. All identifying information has been changed for confidentiality. Sione was a 63-year-old man from Tonga. He was a lifelong farmer and had almost never attended a doctor. He came over to Australia to visit some relatives and he just felt a bit off, nothing dramatic, just not his usual self. So he had some blood tests which showed advanced kidney failure and undiagnosed diabetes. These problems had likely been there for years or decades, worsening over time, and had never caused him a symptom. We did start him on some medication, but unfortunately the damage to his kidneys was permanent. Had he been an Australian citizen, we would have planned towards dialysis because his kidneys just weren't filtering waste out of his body like he needed. But unfortunately at the time Tonga had no access to dialysis, and access remains extremely limited to this day. So Sione returned home knowing that he would only be able to receive symptom-based management of his kidney failure, and knowing that kidney disease would bring an end to his life much earlier than it otherwise would, likely within the next 12 months. Now let me tell you about Susan. She was 45, living in Sydney, Australia. When she was pregnant, she was found to have high blood pressure and protein in the urine. Fortunately, those problems went away after she delivered, and often we don't have any routine follow-up for such individuals, but she was correctly informed that these problems did put her at higher lifetime risk of advanced kidney disease. So she stayed in touch with her doctor and had checkups about once a year, and a couple of years later this did find some protein in the urine again and higher blood pressure. So she made some lifestyle changes, started on a preventative medication, and then a year later was found to still be slightly worse. At that point she was linked in with me, and we had further discussions. We started another protective tablet, and now 3 years later her kidney function remains completely normal, and she's at extremely low lifetime risk of progressing to kidney failure. And the important part is she never had a single symptom. Without these simple tests, she could have walked blindly into a very different future. The difference between Sione and Susan isn't about biology, it's about access to the right information, simple tests, basic medications, and a healthcare system that can act early. Diagnosing kidney disease doesn't require much. It involves a blood pressure check, a urine test, which can often be done as a simple urine dipstick test, and a straightforward blood test. These are some of the cheapest tools in medicine, and far cheaper than dialysis or managing some of the other complications that kidney disease can cause. Yet in many low-income countries, even these are out of reach. Millions of people are heading towards kidney failure without ever knowing they're on that path or that they can do something about it. It can feel like a global crisis too big to solve. But kidney disease is not hopeless. In fact, it's incredibly actionable. There are 3 broad things we can do starting now. Increase access to simple health checks and essential medications, especially in low-income regions. Governments, health organisations and charities can make this possible. Building public awareness. People need to know what their kidneys do, how to protect them, and how to get checked. We need public health campaigns like those that have been so successful in managing HIV and other health problems like cervical, breast and bowel cancers. We need to support and train staff. Nurses, doctors, pharmacists, community healthcare workers, and other health workers need the tools and knowledge to recognise early and respond to what they find. Guidelines already exist and treatments are effective. These approaches don't just save healthcare systems money, they give people back their futures. The International Society of Nephrology is committed to making early kidney care accessible for everyone everywhere. If you want to see how this is becoming reality and how you can play a part, please visit the ISN.org. Because when we detect kidney disease early, we don't just see the problem. We see the future and the chance to change it. Thank you.